that if you are taking vitamin D supplementation with a digestive cancer, and you have the immunity of fighting the mutant P53, it improved your survival by more than 150%.
Welcome, everybody. This is Buck Joffrey with the Longevity Roadmap. And today we are going to talk about something that I think, comes up a lot in the longevity space. It is vitamin D levels. This is something I think that is quite important. As you probably know, I mean, vitamin D seems to be involved with, everything from the immune system to, chronic inflammation, and any number of things, testosterone. And it is something that, at least in my neighborhood, I'm told is a little bit of an epidemic of low vitamin D levels, and is curious why, especially since I live in Southern California. But this particular interview we are doing today with one of the world's experts on vitamin D metabolism, Dr. Michael Holick, explains a lot, and I think you'll find it very useful. Not only from the standpoint of understanding the importance of vitamin D, but how to make sure that you have enough vitamin D yourself and how to do that. So we will have that interview right after these messages.
Hey, longevity enthusiasts, it's time to take it to the next level. I've been fine-tuning my longevity regimen for years, and I look better and feel better than I did a decade ago. In fact, my blood work is even better than it was back then. And it's all because of my data-driven regimen. And it's inspired me to create a course and community just for you. It's called the Longevity Roadmap, and I urge you to check it out. If you're tired of your belly fat, tired of being tired, or just want to optimize yourself for the next 50 years, visit longevityroadmap.com. That's longevityroadmap.com.
Welcome back to Longevity Roadmap. Today, my guest is Dr. Michael Holick. He's a professor of medicine, physiology, and biophysics at Boston University Medical Center. His groundbreaking work has been pivotal in identifying both the major circulating form of vitamin D, 25-hydroxyvitamin D, and its active form, 1,25-dihydroxyvitamin D, leading to significant advancements in diagnosing and treating vitamin D-related diseases. He's got over 600 peer-reviewed publications and several influential books, including The Vitamin D Solution. Dr. Holick has significantly shaped our understanding of vitamin D's role in bone health, immune function, and chronic disease prevention. Welcome, Michael. How are you?
Oh, it's a real pleasure to be on your show, Buck.
Well, let's start out with this. Let's just get into it. Can you walk us through how vitamin D is synthesized in the skin upon UVB exposure and subsequently activated in the liver and kidneys, and why is it considered a hormone rather than a typical vitamin?
Sure. So by definition, right, a vitamin means that you can't make it. And whereas a hormone, you make it and use it. And so as you just asked me, right, how do you make vitamin D in your skin? So by definition, it's a hormone. And the way you make it is that when you're exposed to ultraviolet B radiation, the precursor of cholesterol, 7-dehydrocholesterol, absorbs that energy and it opens up its ring, actually not to vitamin D, but to pre-vitamin D. Pre-vitamin D is thermally unstable, and over a period of several hours, it almost 100% converts to vitamin D. Now, you may ask the question, why think about it as UVB, and why is that so important? And the reason is that just because you're exposed to sunlight doesn't mean you make vitamin D, right? The zenith angle has to be at least 35 degrees because otherwise the vitamin D producing rays, the UVB, is absorbed by the ozone layer. And this is the reason why you make no vitamin D before 9 a.m. in the morning, even if you live at the equator, and you don't make very much vitamin D after 3 o'clock in the afternoon, even if the sun is shining brightly. Also, if you live
that's a really important point. So I did not know that, Michael, and it's interesting because I live in a very sunny area. I live in Santa Barbara, California, and my primary here says that he sees an inordinate number of people with vitamin D deficiency. And we always wondered this because everybody's outside here all the time, but maybe they're just not out at the right time.
Well, from 10 a.m. until 2 p.m. is the maximum time, and that's the time you're indoors.
Yeah.
And that's the time dermatologists tell you should not be exposed to sunlight.
Right.
And it turns out, curiously, that when they tell you to go jogging like at 8 or 9 o'clock in the morning, right, and make your vitamin D, it's the most beneficial time. It's actually the worst time for your skin, because what you're doing is you're getting blasted by UVA radiation, which damages your collagen, increases risk for melanoma, alters your immune system, right? And you make no vitamin D. And the same is true that you can't make any vitamin D in the wintertime if you live above Atlanta, Georgia, basically from about November until the end of March. And if you live, say, in Canada, we've done a study in Edmonton, Canada, 6 months of the year, even though the sun is shining brightly in October, November, you make no vitamin D. And it all has to do with the zenith angle of the sun.
Got it.
With that, all right, and then also just a couple other points about how you're making vitamin D in your skin is that skin pigmentation is a natural sunscreen. And as a result, people with darker skin need to be outside longer compared to me to make the same amount of vitamin D. If you put a sunscreen on with an SPF of 30 properly, which absorbs 98.5% of the UVB radiation, it reduces your ability to make vitamin D in your skin by 97.5% to 98%. And so it's important to take advantage of sensible sun exposure. And you may wonder, well, how do I know time of day, season, latitude, degree of skin pigmentation? And so I worked with a group in California. We developed an app. It's called D-Minder, DMINDER.info. It tells you anywhere essentially on this planet when you could begin making vitamin D, how much vitamin D you make, and it warns you to get out of the sun so you don't get a sunburn.
Well, that's interesting.
So now you make vitamin D in your skin. It's biologically inert, and it travels to your liver, and it's converted, like you said, to 25-hydroxy vitamin D. So when you go to your doctor for a blood test for vitamin D, that's what they're measuring, 25-hydroxy vitamin D. And then it goes to your kidneys where it gets activated to, as you said, 125-dihydroxy vitamin D. Why is that important? Because back before the active form was discovered, people with kidney disease had severe bone disease, and they had a resistance to vitamin D, and they couldn't understand why. But now all of a sudden the light bulb got turned on, because now we recognize for vitamin D to function in your body, it has to get activated, and it has to get activated in your kidneys. And what is it doing? It goes to your intestine, and it tells your intestine to efficiently absorb dietary calcium. And it also increases phosphate absorption. Its major function is to maintain your blood calcium in a normal range, because calcium in your blood, right, is a major regulator of most metabolic functions for neuromuscular activity, for everything. So the body cares about your blood calcium almost more than anything else. And vitamin D is solely responsible for bringing calcium into your body.
Let me ask you this, and we talked about the different metrics that are involved in with the sun exposure and vitamin D production. Is taking vitamin D orally, is it just the same? I mean, is there any difference between taking a 5,000, 10,000 IU vitamin D versus making it yourself? Is there some superior value to making it yourself from the sun?
Well, there are two reasons to think about. The first is what's curious, and we had published this over 4 decades ago, is that it had been argued that melanin pigmentation evolved to prevent vitamin D intoxication, because if you're exposed to too much sunlight, you make too much vitamin D. No. Mother Nature cleverly designed our system. So when you're exposed to sunlight, the maximum you can convert is 15% of the precursor, 7-dehydrocholesterol. So number one is you can never become vitamin D intoxicated from sun exposure. The second is that we showed, and others have shown, that for a variety of photoproducts are being made separate from vitamin D. And some of them we've shown and others have shown may regulate cell growth and maybe even reduce risk for skin cancer. And we published a recent review on this to show how the local production of active vitamin D in your skin, we think, plays a fundamental role in helping to keep your skin healthy.
So you're saying that there are these photo products. Can you talk a little bit more about that? Because I guess the idea here is it's not just vitamin D that you're, the ability to create vitamin D, but there are other things that are included outside of vitamin D that are important that you may not be getting simply by supplementing.
That's correct. We have some very good kind of animal data and in vitro cellular data, but we don't have any clinical data to say whether or not lumisterol and tichisterol, for example, which can be made when you're exposed to sunlight, what their biologic functions are in a healthy person. So for the most part, I've always suggested that most important is to get adequate vitamin D, right? And that, yes, sensible sun exposure makes good sense. And furthermore, and it's a whole separate story, right, is that when you're exposed to sunlight, right, you make beta endorphin, right? You make nitric oxide, causing vasodilation. You actually make carbon monoxide, believe it or not, from hemoglobin, which also is a neurotransmitter. And so there's a whole host of biologic processes that occur when you're exposed to sunlight. And so independent of vitamin D, sensible sun exposure, I think, it should be a good part of anyone's general health.
One of the things I guess people might be wondering right now is I know you mentioned there was an app, but maybe a little bit more explanation of sort of, getting the sun exposure that is helpful here, but at the same time avoiding, something that's going to give you melanoma.
Right. So first of all, in my opinion, at least, and based on the literature, right, most melanomas occur on the least sun-exposed areas, and occupational sun exposure decreases risk for melanoma, right? And so, as a result, it's not just exposure to sunlight, right, UVB, which causes squamous cell and basal cell carcinoma, right? Excessive exposure to sunlight, well documented to increase risk for both of those type of skin cancers. Easy to detect, easy to treat, okay? Melanoma, obviously, is a deadly cancer, but we believe that it's the exposure of UVA that may be actually playing an equally important role in increasing that risk, not so much UVB. And also, we know that having sun-burning experiences as a child and young adult, having bad genetics, having a lot of nevi on your body, these are some of the major risk factors for developing melanoma.
You talk a little bit about vitamin D's role in modulating the immune system. And I bring this up because I remember, particularly during the COVID pandemic, vitamin D came up a lot as it related to outcomes in patients who ended up with COVID infection.
Right. So first of all, even though I said that the kidneys activate vitamin D, which is true, and the kidneys activate vitamin D to regulate your calcium and phosphate metabolism for bone health, and for your calcium metabolism. But we also now know that most tissues in your body also can activate vitamin D, including your immune system. And your macrophages, right, the cells that gobble up infectious agents, the active form of vitamin D is generated in the macrophage. And it tells that macrophage to make defensive proteins like cathalicidin, which then lights bacteria and will inactivate viruses. We know.
So there's like a signal transduction type situation there.
For sure. And we now know that active vitamin D plays a critical role in both innate and adaptive immunity, right? And so when COVID hit, I immediately was in touch with Quest Diagnostics because I had helped them develop their assay many years ago.
Mm-hmm.
And we wanted to see if you could relate vitamin D status with COVID infection. In more than 190,000 samples we looked at, and we showed that if you're vitamin D deficient, you had a 54% higher risk of acquiring COVID. We went on to show at our hospital, if you're vitamin D sufficient when you walk into that hospital, you're more likely to leave that hospital because vitamin D deficiency was associated with high morbidity and mortality. And we think the reason being is that the active form of vitamin D interacts with your T cells, right? That regulates cytokines.
Mm-hmm.
Cytokines that can cause the cytokine storm, that can cause a lot of complications, and cytokines that can help you fight the infection. Also, it turns out that the active form of vitamin D interacts with not only T cells, but B cells. And we believe that it interacts with B cells to modulate immunoglobulin synthesis, to reduce immunoglobulins that are harmful to you, right? These are the autoantibodies. And that's the reason we believe that the active form of vitamin D made locally reduces risk for autoimmune disorders like type 1 diabetes, multiple sclerosis, rheumatoid arthritis, and Crohn's disease. So vitamin D is a major immunomodulator.
Is there any studies showing the, I guess, reversal of vitamin D deficiency and how that might actually help various autoimmune diseases then?
So what we do know is that a study was done many years ago in Finland. And back then in the 1960s in Finland, they were so concerned about vitamin D deficiency and rickets in infants, they gave them 2,000 units of vitamin D a day.
Mm-hmm.
They then followed those infants compared to those getting just a regular dose of vitamin D for 31 years and found it reduced their risk of getting type 1 diabetes by 88%. We also know that if you live above Atlanta, Georgia, for the first 10 years of your life, you have a 100% increased risk of getting multiple sclerosis for the rest of your life, no matter where you live on the planet after that period of time. So there's a lot of evidence to suggest that it plays a very fundamental role. There's a group down in Brazil, Dr. Coimbra, and I've been following some of his patients, and I actually treated one of my patients with multiple sclerosis with very high doses of vitamin D. And he had classic sign with MRI finding and the eye issue. And I put him on high dose vitamin D. I published him recently. He's free of his disease.
I think you also talk about the role in heart disease. Can you talk about some of what you know about the role there?
So there's a couple of issues. One is that we believe that it plays a fundamental role in endothelial cells, right? And you're well aware that alteration in endothelial cells increases risk, right, for inflammation and cardiovascular disease. And it was an interesting study done many years ago where they showed in cultured cells, looking at endothelial membrane stability, actually that vitamin D was one of the most effective compounds for doing so. Actually, even better than 25-hydroxyvitamin D or 125-dihydroxyvitamin D. We know that there's about 200 or so genes in your cardiovascular system that have a vitamin D receptor related to it. And so we believe that it will help the heart pump. It improves cardiovascular health by increasing cardiomyocyte function, and it helps to reduce blood pressure. A very nice study was done to show in a mouse model that active vitamin D can decrease blood pressure. We did a study with Dr. Dong down in Georgia and gave to teenage African-American children, 14 years of age, either 2,000 units of vitamin D a day or 400 units of vitamin D a day. And we showed that looking at ultrasound and vascular blood flow, that it improved if you were on 2,000 units a day.
Wanted to talk a little bit about sort of optimal levels, because I think this is a little bit confusing. On the one hand, I remember from medical school, vitamin D being a fat-soluble vitamin, one that's not going to you're just not going to pee out like vitamin C if you get too much of it. So on the other hand, we want to make sure we get enough of it. Like, what is your belief in terms of optimal levels of vitamin D for people to be targeting with their lab work?
So first of all, just quickly talk about deintoxication, because we've all been taught in medical school that vitamin D is one of the most toxic fat-soluble vitamins. It turns out not to be true, that you literally have to take hundreds of thousands of units of vitamin D a day for months to years before you have to worry about vitamin D intoxication. Vitamin D intoxication is one of the rarest medical conditions. And I'll just give you one example. Is a lawyer in Florida had called me up, and he was really angry with me because back in the 90s, I was suggesting that if you improve your vitamin D status, maybe reduce risk of some common cancers like prostate cancer. So he went on the internet, because back in the 90s, you couldn't get vitamin D, and nobody cared about supplement. So he went on the internet and he bought a product, and in a teaspoon was 1,000 units, and he was taking 2,000 units a day. And he became severely intoxicated.
At 2,000 units?
On 2,000 units. So I told him, look, this doesn't make any sense to me, right? I developed a vitamin D assay to measure how much vitamin D are in pharmaceuticals. And so I told him to send it up. We sent it up. The company forgot to dilute it. He was making pure crystalline vitamin D, 2 teaspoons a day, 1 million units a day. He was severely intoxicated, right? He then called me back. He asked me to be his doc, right? And so I told him, no more vitamin D and avoid the sun without sunscreen. He did perfectly fine. Okay, so with that knowledge, the Endocrine Society in 2011, I chaired that committee, and all the members of that committee were experts in the field of vitamin D. And we concluded that for infants, they require 400 to 1,000 units a day. Children, 600 to 1,000 units a day. And in my opinion, teenagers should be treated like adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more. Recently, the 2024 guidelines came out, and they reported appropriately that you can reduce risk of prediabetes advancing to diabetes if you're on about 3,500 units of vitamin D a day. And other studies have shown that improving vitamin D status during pregnancy on 4,000 units a day can reduce risk of preeclampsia and a whole host of other disorders.
You don't look at it as, I guess you're not approaching it as titrating it with your levels in your blood so much. I mean, that's kind of the way I've personally done it for myself. I've always been sort of low in vitamin D, and I find that, it actually takes me almost 10,000 units a day just to, be in that, the higher level where I need to be.
Right. So the Endocrine Society recommends 40 to 60 nanograms per ml. And we actually know from research that I did with Bob Heaney and others years ago, once your blood level is at around 20 nanograms per ml, if your normal weight, right, every 100 units you ingest, you will raise your blood level by 1.
Mm.
And so you can easily predict what your blood level will be based on your dose. And what's interesting also about vitamin D is that you would think that if you're on 5,000 units a day or 10,000 units a day, that your blood level is going to continue to rise over time. It doesn't do that. When you're on a stable dose of vitamin D, you get a stable blood level of 25-hydroxyvitamin D. And so I take 7,000 units a day based on all of what I'm ingesting. And my blood level is around 80 nanograms per ml. And most of my patients were on 5,000 units a day. Their blood level was between 40 and 60 nanograms per ml. 100, it's considered to be safe.
Okay, 100. Okay, got it.
100 nanograms per ml. And to worry about intoxication, you have to be well over 150 nanograms per ml to even begin to worry about intoxication.
So when you have somebody coming in with vitamin D deficiency, what's your protocol for correcting it? I mean, obviously, you've just mentioned that you're not as concerned about toxicity. And so when I first came into my physician, he gave me, I think, 50,000 units per day for a few days or something like that. What's your protocol?
Right. So I started this in 1998, and we showed that if you get 50,000 units once a week for 8 weeks, you can raise your blood level in that range of 40 to 50 nanograms per ml. And then I switched them to 50,000 units once every 2 weeks forever, because these were mainly my elderly patients, and they didn't really want to take vitamin D every day, right? And they wanted a pharmaceutical because the CVS pharmacy will call them, right, to pick it up so you don't forget it, okay? So, and you may wonder, why 50,000 units? And more importantly, if you order the pharmaceutical, it's vitamin D2, right? And there's a lot of controversy about D2 versus D3, and we could talk about that in a minute. But it turns out it's because it's been grandfathered by the FDA because it existed before the FDA. Nobody ever got the approval for vitamin D3, believe it or not. So you could get it as a supplement, right? But D2 is available as a pharmaceutical. And we've done many studies with vitamin D2, the 50,000 units. It works well. I've done studies as long as 6 years on 50,000 units of vitamin D2 every 2 weeks. And their blood level is 40 to 60 nanograms per ml.
Mm-hmm.
But for those that want to take it daily, my minimum I recommend is 2,000 units a day, preferably 5,000 units a day. And then you'll get in that sweet zone of about 40 to 60 nanograms per ml. There are, however, some people that will actually have higher blood levels than normal, right? Since if you're on 5,000 units a day, you should be around 50, and you might be 90. The reason being that they have what's called a partial 24-hydroxylase deficiency. And what does that mean? It means that there's an enzyme in your kidneys that rapidly destroys 25-hydroxy-D. And if you have a point mutation of one of the genes, then you don't break down as much, and so your blood level is higher. If you have both genes are destroyed, you're in serious trouble because you wind up with severe hypercalcemia.
How about this discussion about D2 versus D3? I mean, there's a lot of, you hear a lot about this debate. And while you're at it, maybe just mention the role of, vitamin K.
Okay. So regarding vitamin K, so they argue that vitamin K is necessary for vitamin D to work. In my opinion, that's nonsense. And not only is it nonsense, but we have a book called Nutrition and Bone Health that I edited. And one of the world's experts, Dr. Sarah Booth out of Tufts, she had concluded in the last time that this book came out that there's really little evidence for that. And I think she's going to be doing the same again for the most recent edition. Because the argument is that vitamin K, right, is telling your calcium to go to your bones and not to your blood vessels, right? That's the argument, okay? And the reason for that is that vitamin K, right, gamma carboxylates, right? That's why it works for coagulation, right? It gamma carboxylate your factors, and as a result, you have coagulation. There are two proteins in your bone that also are gamma carboxylated, right? But they're not related to bone mineral density, okay? And so in my opinion, I always tell my patients, you're welcome to take vitamin K. I don't have any problem with that, all right? But it really does not make any difference in my opinion.
How about the D2 versus D3 question?
And so a study was done by Dr. Heaney back in the early 2000s. And what he did was, because there was no 50,000 unit of D3, he gave 10 5,000 unit tablets to people or a 50,000 unit of vitamin D2. And he looked at the blood levels of vitamin D. And what he concluded was that, yes, the vitamin D level does go up. But he found that the vitamin D level 25-hydroxy-D level went below baseline. So he therefore concluded that vitamin D2 destroys vitamin D3. That's what got everybody's attention. And that's why overnight, many of the multivitamin manufacturers switched vitamin D2 to vitamin D3. So what is the real story? So we did a study because I didn't see any reason not to doubt that, right? So we gave 1,000 units of vitamin D2, 1,000 units of vitamin D3, and then we gave one capsule that contained 500 units of vitamin D2 and 500 units of vitamin D3. And we looked at the 25-hydroxy vitamin D levels over time. They did not change. They were the same. They rose to the same degree and were maintained to the same degree. It's possible there's some data out there that massive doses of vitamin D2 may be less effective in raising the blood level, but for the most part, physiologic doses of vitamin D2 work as well as vitamin D3.
In terms of mood and cognition, vitamin D status, is there any evidence that it actually affects mood and cognitive function, particularly in older adults?
Yeah, so there are a lot of studies out there, association studies, right? Not RCTs, right? Randomized controlled trials that have shown that elders, especially that are vitamin D deficient, are more likely to have Alzheimer's disease, more likely to be depressed, more likely to have neurocognitive dysfunction. There is evidence in animal studies to show vitamin D deficiency will decrease your serotonin levels. And then if you give vitamin D, it improves their serotonin levels, making you feel better.
Interesting. Do you know if there are any trials on that in terms of trying to, use vitamin D as an adjunct for mood disorders or anything like that?
Well, the problem is that people have been concerned about how much vitamin D to give. So many of these studies that are done are not really very valuable because they're giving like 600 units or 1,000 units a day. So more studies need to be done with higher doses, right? I mean, that study, the D2D study, looking at the effect of vitamin D, 4,000 units a day to reduce risk of prediabetes going to diabetes, right? You need 4,000 units a day, right? Now you're getting your blood level in the range of 40 to 50 nanograms per ml. And now
Yeah.
you're beginning to see a lot of the potential health benefits of vitamin D.
There's obviously a bunch of buzz around longevity, cellular aging, and that kind of thing. I believe there's some research linking vitamin D levels to at least to longer telomeres. Is that true? And is there any other role that you know of with vitamin D influencing cellular aging and or longevity?
So that, yes, I'm aware of that study as well. These are in vitro studies to suggest that it improves telomere length. I mean, the telomeres are not lost as quickly. The telomerase is better controlled if you're vitamin D sufficient.
Yeah, I wonder if that's again one of a sort of its hormonal role with telomerase.
Well, so like I said, what's interesting is that the body's not stupid, right? And so the body cares about your blood calcium first, right? So it utilizes vitamin D efficiently in the kidneys to activate it. But once you've satisfied that requirement, now most of the tissues in your body, including your brain, can activate vitamin D.
Mm-hmm.
Right. And we think that active vitamin D is playing a very fundamental role in regulating cellular growth, neuronal activity. So, yeah, we think that it is very important overall for your mental health and for longevity.
You've cited it just really an abundance of a lot of correlations, right? And I guess one of the questions is this correlation or is this causation? What evidence do you look at when you really think, well, gosh, yeah, there's a lot of correlation here, but there's also, plenty of evidence on causation. Randomized control trials, anything like that, specifically that you like to look at when you are, really suggesting there's causal effect to a lot of these things.
So, they consider randomized controlled trials the gold standard. And I don't have any problem with that if they're conducted properly. And that's the problem, because most of these studies are not done well at all. Many of these studies, unfortunately, they take all comers. So they don't focus on vitamin D deficient patients only, right? The Vital study is a good example, right? Is that they sent out to 50 and 55-year-old and older men and women, right? 2,000 units of vitamin D or placebo, right? It turns out that more than 50% of that group was vitamin D sufficient at baseline, right? So if you're vitamin D sufficient at baseline and you're getting vitamin D, why are you going to expect to see a significant effect? However, what's interesting is that when you do subset analyses of the Vital study, for example, they showed very impressively it reduces risk of autoimmune disorders by 22%. Right? The D2D study, originally, they didn't find any benefit of reducing risk for diabetes, from prediabetes, until they looked at those that were deficient. And then all of a sudden, they showed more than 50% reduced risk just by improving your vitamin D status. Another study that was published in JAMA back in 2019 out of Japan, they gave patients with digestive cancers that had gone to surgery 2,000 units a day of vitamin D and followed them for several years. And they published in JAMA, no benefit. And then they went back and did a subset analysis. And they asked a fundamental question, which was, what if the individual was now fighting a mutant of P53? And if they had the antibody for P53, and if they could show in the pathology antibody activity against the mutant P53, and they showed that if you are taking vitamin D supplementation with a digestive cancer, and you have the immunity of fighting the mutant P53, it improved your survival by more than 150%.
Fascinating stuff. If you're just giving one bit of advice to people in terms of, supplementation, that sort of thing right now, just for takeaway, what would that be?
So a couple of issues. The first is, especially now with the new guidelines that have come out, is that insurance companies are now less likely to actually cover the assay. So is it really necessary for you to get a blood level? And I tell my patients, look, obviously it depends upon the time of year that you get it. So we did a study, by the way, in 2.3 million samples throughout the entire United States. And we showed that from the end of the winter, your blood level is at around 22 nanograms per ml. And at the end of the summer, it's at around 29 nanograms per ml. And we think you should be at a minimum of 30. Okay. So my recommendation has been for infants, minimum 400,000 units is perfectly fine. Children, I also recommend 1,000 units a day. Teenagers and adults, 2,000 units a day minimum. And if you want to improve it even further, 4,000 to 5,000 units a day is very realistic. But if you're obese, you need 2 to 3 times more.
Is there a benefit in your mind of going from, having blood levels of 30 nanograms versus 90?
Right. So there is, in my opinion, the most of the evidence is in that sweet zone of 40 to 60 nanograms per ml. In my opinion, there's no evidence to suggest that raising it to 100 is going to make any difference. But the data, there's a very nice study that was done looking at prematurity. And they showed that if you raise your blood level, the pregnant women, to 40 nanograms per ml, it reduced risk of prematurity by more than 40%.
Got it.
So, but there's no, in my opinion, no evidence above 100 is going to make any difference. I mean, we did another study, where we gave healthy adults that were vitamin D deficient either 600, 4,000, or 10,000 units a day for 6 months. And we showed, when we looked at the white blood cells and the amount of genes that are being affected, even on 600 units a day, if you're vitamin D deficient, you improve them by about 150 genes up and down regulated. 4,000 units a day, about 300. 10,000 units a day, over 1,200 genes in your immune system being influenced. And the levels were in the range of about 60 to 80 nanograms per ml.
Got it. So keep it under 100. Generally is a good.
Have it above. And there is some evidence to suggest that if you do that, you could wind up with hypercalciuria, because you may be more efficiently absorbing dietary calcium, and you're peeing it out, and therefore increasing risk for kidney stones.
Sure. Well, this has been fascinating. Your book, you've got this book called The Vitamin D Solution, which people should check out. Can you also, Michael, remind us of that app? Because I think that sounded like a very useful app for people to consider.
Yep. So DMinder, DMINDER.info. Free on your Android and on your iPhone.
Got it. Fantastic. Thank you so much for your time today. And if we want to learn more about your work, where do we go?
So go to my website, just drmichaelholick.org, or you could go, if you want to follow, because I have stage 3 prostate cancer and I'm now in remission, you can just go to Facebook, just Dr. Michael Holick. And I have 29 chapters explaining what it's like to be diagnosed, both as a patient and as a doctor, and how you deal with all of the issues and complications associated with treatment.
Fantastic. Thank you so much for your time.
My pleasure. It's nice to meet you, Buck.
Thanks for listening. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe.